2020. This is Thursday, as opposed to our Friday wrap-up because of the holiday tomorrow. Just to recap this week, I'm County Executive P.J. Wendell. Alongside is Christine Skylar, our Public Health Director. At this time, to recap, on Saturday we announced one new confirmed case of COVID-19, bringing our county total to 14. On Sunday, we added 4 new cases. That brought our total to 18. And we announced that our county's first fully recovered person was listed. On Monday, we announced one more new case, bringing the total to 19, and also announced that a second death due to COVID-19 complications had occurred. On Tuesday, there were no new cases, leaving our total at 18, and at that time, 9 were active, 8 had fully recovered, and 2 were fatalities. We also launched a daily phone update for individuals who may not have internet access or access to the newspaper. People can hear the numbers, which are updated daily by 5 p.m. by calling 1-866-604-6789. Again, that is 1-866-604-6789 and pressing option 6. Wednesday, we announced there are 2 new cases, a male and a female, both in their 40s, bringing the total number of confirmed cases to 21 in Chautauqua County. At the present time, we have 1 additional test to result as a positive. This is a male in his 20s, bringing Chautauqua County's total to 22 confirmed cases and 9 active cases. We have 11 folks who have recovered, 2 fatalities, 17 under quarantine or isolation orders and are being monitored, and to date we have had 256 negative test results. We'd like to announce that New York State has launched the Pause Enforcement Task Force, where individuals can file complaints regarding the operation of non-essential businesses or non-compliant gatherings at a 24/7 hotline. Employees may also file a complaint about their employer or place of work. Submissions are reviewed for completeness and accuracy, and if found to be valid, are forwarded to local authorities for enforcement. That number is 1-833-789-0470. Again, 1-833-789-0470. It can also be accessed via the internet at coronavirus.health.ny.gov/new-york-state-pause and click on the File Complaint tab to the left-hand side. At the present time, we're also working with United Way in both northern and southern Chautauqua County. They're collecting homemade masks and cleaning supplies at various drop-off sites throughout the county. They will be distributing those donations to community service organizations who will provide them to the community. I'd also like to remind at this time that Governor Cuomo has extended orders regarding the operation of essential and non-essential businesses through April 29, 2020, as well as the postponement or cancellation of any and all non-essential gatherings of any individuals at any size. As such, this will also extend the current limitations on county government operations by 2 weeks. I will be extending the local emergency declaration for Chautauqua County next week when the declaration is set to expire. At this time, we'd like to turn our press conference over to Christine Skylar, our Public Health Director.
Thank you, County Executive Wendell. Just one little clarification on our numbers for today. There's 117 under quarantine or isolation orders that we're monitoring currently. Given that this is coming upon Easter weekend, I know this is a very difficult time for many people who are used to being able to catch up with extended family and friends. It's very difficult at this time to not be able to do that. And believe me, I share your pain in that. There are other things that you can do. We're lucky that we have the technology that we do now. And there are things to occupy your time, such as going through old pictures, cleaning out that junk drawer, cleaning out your closet, getting things ready to donate to those who are in need. Maybe I'm being selfish because I'm thinking of the list of things that I would like to do if I had time on my hands right now to be at home, especially use this time to to spend some quality time with your children, if you're lucky enough to have some at home, and with your significant other or spouse. We would like to especially give a reminder out there for what we call our snowbirds, or those who are returning back to Chautauqua County from having a home, usually in some warmer region of the country. Anybody traveling in, we're asking that they please self-quarantine for 14 days. That means just really stay home. We do realize there could be some essential errands that have to be run, or maybe even a trip to the pharmacy. Please limit that as much as possible, or if you know someone who's elderly or has underlying health conditions, please reach out to them, and knowing that they are going to have to restock their homes, and offer them your assistance if you're young and healthy. We ask that they please limit interactions with others and consider grocery delivery instead of pickup at this time. Another thing that we are noticing, that some new things in the governor's order today as far as recreation. As of today, golf courses and the use of boat launches and marinas for recreational vessels were deemed to be non-essential. That is a change for regular business in New York. Golf courses had been able to be opened. As of now, they are not able to be opened anymore, and that will be enforced. With the warmer weather, there are restaurants and establishments such as ice cream places that have outside seating areas. Just please know that outside seating areas are not open. They are to be cordoned off, and everyone really has been complying with that, but it's just a general reminder as the weather does get warmer that you are not able to gather for outside seating in those areas as well. Dr. Wendell, that would be good. County Executive Wendell had talked about homemade or cloth face masks. And I just wanted to reiterate a couple of things about those face masks when it comes to the fit of them and the wear. I've been absolutely amazed at the creativity and the skills of so many people in our county who've been making homemade masks. When you're going to make or wear a cloth face covering, the State Health Department recommends that you make sure that it fits snugly and it covers your nose and your mouth. Make sure that it can be changed frequently and launder it when it is soiled. And please don't become complacent with other measures for protection. That means still don't touch the cloth that's covering your face, and be careful when you take it off so that you don't touch the front of it. Continue to be vigilant about frequent hand washing. Sometimes it's very easy to relax all of the other recommendations that we're sending out there because you have a mask on. And the mask is something that really protects those around you from you coughing or your droplets infecting others. So please continue to practice social distancing. The recommendation is 6 feet of distance if you have to go out into public or you have to be in close contact with someone else. And we're asking that you please stay home and flatten the curve. I wish that everything that we got as far as feedback was positive, but unfortunately we have been getting a lot of reports of people continuing to gather, people making multiple trips a day to the grocery store or to the local convenience store. We really need to continue to stress that that is not okay. Make a list and go very infrequently, as less often as you can. Please designate one person to go to the store if that's possible. An entire family should not be going and out and doing some recreational shopping at this time. It really is counterproductive to everything that we are trying to get done here with social distancing and flattening the curve. We have also received a lot of questions about testing within Chautauqua County. Yes, we are fully aware that testing rates are very low in our county. This week, we have been made aware of an increase in the supplies within our county, and because of that, I did, just yesterday, put out updated guidance to our healthcare providers on who should be tested. Anybody who is symptomatic for the COVID-19 infection is to contact their healthcare provider and would qualify for testing if they meet these priority populations. First of all, that's hospitalized patients. So anyone who is in the hospital currently or who is in the emergency room and is going to be hospitalized is the first priority for COVID-19 testing. After that is nursing home residents who are symptomatic for COVID-19, and then any healthcare worker who is symptomatic of COVID-19 is prioritized for testing. And that does not just mean, a doctor or a nurse in a hospital. It could be in a private practice, could be in a nursing home, could be home health care. There are many other places where healthcare workers work than just our hospitals. But then the next priority population are those with chronic health conditions, such as heart disease, diabetes, chronic renal failure, and those who are immunocompromised. So if someone is undergoing treatment, such as chemotherapy for cancer, or they're on one of the newer arthritis injectable medications that really wreak havoc with the immune system. And after that, it goes to essential workers who are in direct contact with the public frequently, especially those such as my staff that are working in public health, or those who are in daycare centers, our first responders and law enforcement, our own child protective services workers. So again, to go over the symptoms that are generally being looked for of COVID-19, a fever, usually of 100.4 or greater, a cough, what you think of as your upper respiratory infection symptoms, and also any of traditional flu-like symptoms such as diarrhea and fatigue. We received updated guidance this week from the State Health Department. They have changed the definition of when we as public health do our contact tracing of a positive case for COVID-19. It used to be from the day the person became symptomatic. We are now going back 48 hours prior to the symptom onset for starting our contact tracing. So that is increasing the number of people who could have potentially become exposed to COVID-19. And that really is because all of the data right now is showing that 25% or more of people could be carrying COVID-19 and not be showing symptoms as of yet. So that's why we're going back 48 hours. Another really good reason why, even though you feel good and you don't have any symptoms, that you need to stay home. You can wear the cloth mask now to protect others around you in case you are carrying an infection or asymptomatic. And especially if someone is elderly or they have underlying health conditions that puts them at a higher risk with infection, to please be very mindful of social distancing, staying home, and taking care of yourself. The amount of people that gets tested really depends on healthcare providers in our county. If someone is feeling ill, they are to contact their healthcare provider. If they don't have a healthcare provider, the Chautauqua County Health Network and the Chautauqua Center are both poised to help people find a healthcare provider immediately at this time. The healthcare provider then does an assessment of the patient, and that a lot of times right now is happening via telemedicine. And then the healthcare provider determines whether or not someone will be tested. I fully anticipate with expanding the testing guidelines as we have now, and because we have more supplies in our county, we should be able to increase the number of people who we are testing. That doesn't mean that we are testing people who are not symptomatic at this point, and it doesn't mean that it's a free-for-all if you've got just mild or moderate symptoms and you're young and you're healthy without any of those other risk factors that I talked about. We don't have enough supplies to do that, not by a long shot. But we do have enough supplies right now that we are able to test more people than we have been able to so far. I'm very thankful for that. I'm also thankful for the partnership of our local physicians and other healthcare providers who will help us to increase the amount of people that we're testing. Governor Cuomo has said, we need to test. We need to know where the disease is. We need to know how many people really are carrying it around. And if we don't test, we don't know. And believe me, we know that. It's been very frustrating for us to not be able to test as much as I certainly in public health would like to be able to test. And we now are at a point where we have a few more additional supplies that we should be able to loosen up somewhat on how we've been prioritizing and test more patients. I think a lot of our providers out there, especially this week. This is National Public Health Week. I think it's very fitting. We're in the middle of the biggest public health crisis of our lifetimes. And I would really like to send a special kudos out there to my own public health staff. They are working tirelessly, 24/7 for a whole lot of them, in doing disease surveillance and follow-up and checking in on our people in isolation every day, doing a lot of health education, and so much stuff is going on behind the scenes, and it really has been all hands on deck. And I really hope that everyone remembers them as part of our healthcare system as well. And I guess that's all for me today.
All right, thank you. At this time, we'll open the floor up for questions. We will call you out. We'll start at the bottom today. We'll start with WRFA. Jason Sample, do you have any questions?
Yes. PJ and Christine, can you hear me okay?
Yep.
Super. I wanted to ask about the oversight for food and restaurants, and in terms of the health department. I know in the past, when normal times, the health department would typically do inspections of places that serve food and all that. I wanted to know if they are still ongoing, and if there's been an increased number of complaints at the health department due to concerns of either employees or people coming in and out that could be carrying COVID-19 and passing it on to customers.
Thank you. Our staff in environmental health is continuing to perform some restaurant inspections. We have been instructed by the state that it's okay to limit some of them. Right now, that's been easy to do because most of them, so many of them are closed, sadly. So the ones that are open, that are offering takeout and delivery, we are still in close contact with. We have been making sure that they are following public health law and our sanitary code in their kitchens, as well as handling, food handlers. And the other part of the question, concerns of the disease. Healthcare or essential workers really does include those who are working in our stores and our restaurants and such. We've provided a great deal of educational information out there to them on how to safely interact with the public at this time, which includes the 6-foot social distancing as much as possible. I know I've heard concerns about handling money and handling credit cards and handling bags, and what do we do with all this stuff? The main thing to remember is you need to wash your hands, and you need to not touch your face. If someone who has, let's say, COVID-19 hands you a dollar bill, and you take that dollar bill and put it away, and then you use hand sanitizer or you wash your hands, you're okay. But if someone hands you something that could be contaminated, and then you decide to rub your eyes or your nose or do anything like that, chew your nails, that then is when the contamination happens because of the contact with your mucous membranes. So the most important thing you can do is wash your hands and use hand sanitizer if soap and water aren't available, and don't touch your face. Easier said than done, I know, but we are trying to manage any complaints that do come in. We have, I think, a very rapid response as far as following up. We have had sanitarians going directly and immediately into some local taverns that we've heard have been open, and other places where there have been concerns about the inability to social distance between patrons. We really are asking, not so much from the restaurants and those that are businesses that are trying to stay open right now, but from the general public. Unless you're standing next to the members of your household, don't be standing next to people. Don't congregate in a group while you're waiting for your food order to be ready or while you're waiting for your ice cream cone to be made. You need to keep your distance between people. And short of, Sheriff Quattrone sending all of his force out there with a bullhorn to yell at everybody, I don't know how else we're going to do that. We don't have martial law here. We don't have a shelter-in-place order. So we do need people to use their common sense, take this very seriously, stay home as much as possible, and just keep your distance from one another.
just a quick follow-up. Is there a mechanism if, say, you're an employee at a supermarket, for example, and they're working, you have somebody working in the bakery who isn't following standard procedures and the management isn't doing anything, is there any other mechanism that the employee could follow through on to voice their concerns without obviously compromising their own employment as a result of blowing the whistle, so to speak?
Yes, Jason, we do have, the question was, is there an opportunity for an employee to comment on the management or his place of business? And there is that New York State Pause hotline that we gave you. Again, that number is 1-833-789-0470, or it can be reached via the internet at coronavirus.health.newyork.gov/new-york-state-pause. Again, that's the opportunity, and the state has established that for employers or employees or residents to contact the state. That call will be taken 24/7. And myself and Sheriff Quattrone do get emails regularly throughout the day. I think today we've had in excess of 20 of complaints we've had from employees of their employers, others from other individuals about businesses, non-essential businesses, et cetera. So recommend to everyone, if you have any questions or concern about those businesses, you feel they're not in compliance or your own employer is not, please contact that number and the information will get to us and we will investigate the situation.
Any restaurant or facility that we as the local health department permit, such as a restaurant or a bar, you can also contact us directly at the health department, and we will investigate. Grocery stores they're permitted differently. They're under the New York State Division of Ag and Markets, so that is another avenue that you can take, and we can also help to pass specific complaints up to the Ag and Markets Department as well.
Very good. Thank you both so much.
Thank you. Justin Gould, Western New York News Now.
First, I wanted to say to Christine and her staff, thank you so much for all the work you guys have been doing. And like you said at the top of the press conference, certainly it's a little ironic that this week is the Public Health Week, but certainly needed. So good job to you, and good job to Executive Wendell, too, for staying transparent and coming on our program. I just wanted to thank you for that and your constant communication. My question for Christine is in the fact that early on we were told to wash our hands and not touch our face. And then last week, now new recommendations continuing, wash our hands, don't touch our face, but now we could wear these masks. Why was there that shift?
I think the big shift came at the direction of the CDC at the federal level. In general, we weren't seeing a lot of community transmission of COVID-19. Now, from what we've seen in New York City and other hotspots around the nation, we know that COVID-19 is here and it is being spread throughout the community. So wearing the cloth masks now has been deemed a prevention strategy, where early on in this we just didn't have enough information and there really wasn't evidence of community spread of COVID-19. And honestly, because of I guess you could say, the lack of testing that we've been able to do in Chautauqua County, we're not a community that's designated as a high transmission in the community. We're in a mild to moderate range based on the number of cases we have and the number of people that we're monitoring. But that doesn't matter to me. We really still need to be vigilant, and I still recommend the wearing of the cloth masks by the general public when you're out. If you cannot maintain 6 feet of distance from other people when you're at work, or if you're in the store or something like that, then it really is a community mitigation strategy. That doesn't matter that we don't have that as many positive cases here as they do, around the state or in other places in the nation. It's something that we really need to be doing now. We have enough evidence that's showing that it's something we should be doing.
If I may, a follow-up in regards to folks' mental health, because I would imagine, for myself, it is kind of hard to have that 24-hour cycle of, society is different. It's springtime. We want to get out. We maybe want to take a boat on the lake. We want to go out and play a game with our friends and things like that, but we can't. For folks who are struggling, what advice do you recommend them to adapt to what seems like a new normal now?
I think some of that depends on the person, and if someone is struggling with depression or anxiety, if they already have a provider, a clinician, or a therapist, then they need to be in touch with that person. If someone's struggling already with a mental health issue or substance abuse, the Mental Health Association is still there for the peer support that's been there. There is a mental health crisis line, and I apologize because I don't have it on me right now, but it is on our website. It's on the county's website, the 24/7 for mobile crisis support. I think from what I've heard, a lot of people have gone to journaling. We're doing a lot of yoga, a lot of self-help techniques that are out there. Catching up on things that you haven't had time to do at home, I think, is something that you just, I know this is a hard time, and we have to keep busy, but we can keep busy in other ways. Catch up on those books that you've been wanting to read that have been sitting on the shelf collecting dust. This is a time where it's very easy for people to become isolated and feeling alone. And I'm really hoping that they'll reach out for support, whether it's mobile crisis, it's a mental health association, it's a friend, it's a pastor, it's anybody. Now is not the time to let yourself fall into your own shell and go down the path of alcoholism, drug abuse, or even contemplating suicide. This is the time really to reach out. Just one phone call will help, and also for everyone else on the other side of that, to take care of each other. Look out for your neighbors, look out for your friends, make that phone call, make the text, get a hold of somebody on Facebook, just check in, see how people are doing, and see if there's some way that we can try to keep everybody uplifted through this. This is a hard time, but we are going to get through it. We don't have an exact date, we can't say an exact date, but you know what, this is going to end. This is temporary, and we're going to come out of this stronger and better for it. But we have to stick together through it and really help our friends and neighbors.
Thank you.
State started was the New York State Take 5, and just like Christine said, that is 5 minutes to pick up the phone, call a neighbor. We want to remind people it's social distancing, not social isolation. So just to pick that up, that has been going. That's been an initiative from New York State Association of Counties as part of that. So we do want to remind everybody, pick up that phone and reach out to a neighbor or a friend or somebody you haven't talked to, especially this weekend where most people, it's been commonplace to get together with family and friends for the holidays. So we do want to remind everybody that, again, take that 5 minutes to reach out, and it may mean the world of difference to somebody. Any other questions? All right. We're going to move on to WDOE. Greg Larson, any questions?
Yes, good afternoon to the both of you. This first question I have is in regards to the concentration of the confirmed cases in the county. A few minutes ago, the county's COVID-19 map has been updated, and as of today, 14 of the 22 confirmed cases are in the northeast part of the county. My question in regard to that is, do you have any explanation as to why you believe that there is such a relative high concentration in that part of the county? And do you have any idea why in Battalion 2, the western half of the county, why there have been no confirmed cases at this time?
Well, I wish that I had all the answers on that one. We are doing some epidemiologic tracing on those and actually trying to see how much connection there is between. Some of those cases have been connected to someone else who's been positive, so we are seeing some of that in that area. Some of those cases have had known travel to Erie County and areas where there was more disease that had already been identified. So I do think that's part of the factor in the North County, more so than the South County. I think it's just a matter of time before we see something spike up in the area that currently, I don't remember the number of the battalion, 2nd Battalion, where there haven't been any cases showing up yet. I don't think there's any scientific reason for that. I just don't think we've happened to test anybody who's been symptomatic and living in that area. Some of it could also go to population, that really isn't a very highly populated if we look at the rural area there. It's very interesting, and epidemiology is actually fascinating when you really start to dig into what we have going on. And so I really wish we had, could have had more testing ability up till now, and I'm looking forward to testing more so that we can start to put some more of these pieces together locally. I really honestly do think the social distancing in our county has made a difference. I think thanks to people really paying attention. Those of us who live in the country, I think we're a little more used to, staying apart, and we have more room to roam of our own. The denser areas where there's more population, that's been a little more of a struggle for people. I do think, though, that what we've been doing with social distancing is working to flatten the curve as we were hoping it would. I could be wrong on that, and we could have a wave come our way. I hope not, but we do need to test more to find out and see what's happening out there.
All right, and that leads me to my second question. Erie County Executive Mark Poloncarz recently announced that he believes his county is about 2 weeks away from reaching their apex. Do either of you have any time frame in regards to whether our county might reach its apex?
That's a difficult question as far as what we'll look, what we would look at. I know County Executive Poloncarz did state at one time that he was looking at the number of cases and how they continue to grow. In one case, when it first started, they were doubling every 3 days, and then they got to where they were doubling their positive results every 2 days. So there's different parameters they're looking at for his county. He has a much larger county, much larger testing, and also much bigger percentage of positive cases. So their data is probably a little bit more suitable for predicting that. For us, our data is somewhat limited, but again, it's hard to tell. I mean, everybody across the board would like to say we really could predict this, but I don't know. Christine could chime in. I don't know if there's any real indicators. I could tell you right now, the last 4 days in New York State, the number of hospitalizations have gone down, the number of ICU admittances have gone down, and the number of intubations or people placed on ventilators has gone down. So as a statewide, the governor is looking at that as a positive trend. We'll continue. I haven't gotten today's update as to whether or not for the 5th day that did occur, but I know we have seen some trends that have showed that the numbers are going down in what someone would consider a positive way. But as far as prediction, it's very difficult. There is no formula or model to use at this time.
Yeah, it really is difficult. Erie County has a lot more hospitals. They have tertiary care centers. Our community hospitals really aren't at the same level of care as what you're seeing in Erie County. So they're looking at things a little differently than we do here. I have a little bit of fear that if we stop on our mitigation efforts and we're not as stringent as we are right now because we think, it's not going to get that bad here and we're all right. About 2 weeks from now, we are going to see a lot worse because when you look at an incubation period of 14 days or so that we know of with COVID-19 and you decide on Sunday that we're all right and we're all going to get together and have 50 of us in our neighborhood or our family or whoever get together, and about 2 weeks from now we could really be testing and see a huge spike. And it's mainly going to be your special needs child, your elderly parent or grandparent, your family member battling cancer who's going to be hit the hardest with that. So that's why it's so important for us to continue to be vigilant as we are now until we really can do enough testing here and we have enough clear signs that we really are on the downhill side of that. We are nowhere near yet to be on the downhill side of this.
Okay, thank you.
Any other questions? All right, moving
That's
on.
it.
Thank you, Greg. Mr. DiAgostino from the Observer and Post-Journal.
Thanks, thank you very much, and good afternoon. Good news we've been seeing is there's been some recoveries from these positive cases. So our question really deals with the recovery process. How are they determined to be recovered, the people who've tested positive? Does it involve having to take another test? And once people are deemed recovered, are they advised with any specific instructions and are they safe to go out? So really 3 questions on recovery there.
And really, and you think I'm going to remember all 3? I'll try.
Okay,
Okay.
start with the first one. How is a person determined to be recovered?
A person is determined to be recovered based on our New York State Health Department advisory. And really what that means is somebody who, if they are still symptomatic, but they were confirmed of having COVID-19, they can discontinue home isolation once they meet the following conditions. There are at least 3 days or 72 hours have passed since their time in the 14-day isolation is gone. They've been without a fever, without using any fever-reducing medication. That means that no Tylenol or Advil or anything like that. There's also been an improvement in the respiratory symptoms, and it's been at least 7 days since their first symptoms appeared. In that case, we generally give them the same information we give everyone else to continue to practice the proper hygiene protocols, avoid close contact with others, and manage themselves. So that's for somebody who's been symptomatic and confirmed of COVID-19. Now, there are also some people who, if they may be confirmed positive to have COVID-19, but they've been asymptomatic, that means they've had really no symptoms. And in order for them to be considered recovered and be able to discontinue their home isolation official order, at least 7 days have to have passed since they had the diagnostic test, and they've had no subsequent illness since in that time. So, and that is from the State Health Department, is where I was reading, and that's the advisory that came to us as healthcare providers and local health departments on when someone can be released from isolation and quarantine if they've tested positive for COVID-19.
Okay, so what's the procedure when someone tests positive? I mean, who is really being informed? What is the process the health department takes because we have 22 cases now? So what's the procedure? Is obviously families contacted, but what's the next step? Who else gets contacted in this?
When we have a positive COVID-19 case, we currently, as of the updated guidance this week from the State Health Department, we do what's called contact tracing. And we go back 48 hours before the onset of symptoms and see everybody who that person has been in close contact with, and that comes from interviewing the person who's been confirmed positive. And then the nurses go and contact everyone who has been deemed as a close contact. I know we've had questions on, well, what does a close contact actually mean? And it just happens that so many people have asked that question that the State Health Department has now given us, just on April 8th, an updated definition of a close contact with a COVID-19 case in the community setting. That would be someone who shares the same household, if you have direct physical contact with someone, if you have direct contact with infectious secretions. That means you literally had droplet spray touch you. If you have been within 6 feet of a case for 10 minutes or more. So think of that as being in a car, maybe traveling with someone in a confined space. So we actually then look at other factors like the proximity of the contact, how long someone was close to someone, because the longer the exposure time is, the more likely there is that there was an actual risk of exposure. And we also look to see whether or not the person was symptomatic. Coughing and that droplet spray is what increases the likelihood that someone has been exposed. Those are the things that go into our decision making of someone being considered a close contact that would be quarantined.
And one last question. Obviously, the governor's backed off on the whole discussion on ventilators being taken and moved to locations where they're desperately needed. But has the county reached out to potentially Erie County since they're facing, an increase and probably a bigger crisis, much bigger crisis than we are? So is the county sharing any resources with Erie County or neighboring counties at this point when it comes to PPE or the ventilators?
We haven't really received any requests. We talk frequently. I know County Executive Wendell talks with County Executive Polkars, and me and my staff are in contact with the Erie County Department of Health. There's a report that goes in every day, and it's called a HERDS report, that every hospital compiles data and sends into the State Department of Health. And that data includes how many patients you have in your hospital, how many are in ICU, how many ventilators you have, how many are being used, how many you're staffing, a laundry list of things that's there. And we get a daily situational report, which is shared with the local health departments for every one of the hospitals. So everyone is aware of what's going on in every other area. So if a need arises, we know where that need is, and people have been really great about reaching out and helping one another if that case comes up.
Just to capitalize on that as well, as I contact County Executive Poloncarz regularly, we go back and forth. If there's anything we need, we're just a text message away. I know John Griffith, our Emergency Services Director, he's in contact with Chris Baker from Cattaraugus County. So the connection we have, at least in our two neighboring counties, has been pretty extensive. We've got a great working relationship with those counties. So I know very confident that if we need anything, County Executive Poloncarz would be happy to help, and I know we would do the same for him if the question is asked. So we are in constant contact quite often, actually, and we do make sure everybody's okay, and if there's any needs, we help out as best we can.
All right, that's great to hear. Thank you very much.
Any other questions? Seeing none, I would like to take the time, personally to thank everybody. I know, in this, we're all practicing our social distancing. I usually get out and walk around the campus, but I practice what I'm asking others to do, and we stay in our office. My staff has done a phenomenal job. We're going on 4 weeks now. I know our Department of Health and Human Services staff and other auxiliary services have been working round the clock. It'll be 4 weeks on Sunday. So I personally would like to thank everybody who has given their time and effort, and the families as well, because this is a challenging time for everybody. Being National Public Health Week, again, taking time to remember our frontline workers, our healthcare workers, those in public health. Also, anyone who's essential in business right now. We oftentimes think of our firemen, our police officers, our first responders, but we also have to remember there are those individuals who are out there that are, manning the gas stations, who are working in our supermarkets, and take a bit of time to remember them as we get to this holiday weekend. Again, I applaud the effort, but we need to keep going. We can't slow down now. We need to keep this effort going of social distancing. We need to remind everybody, if you're returning home from your winter vacation or your winter home, to remember to quarantine yourself for 14 days. And we need to keep our efforts as strong as they were on day one, or as strong as they were last week. We need to just continue to remember what we're doing. That is how we will, come out of this and be successful. At this time, I like to wrap up our press conference and thanking everybody. And in our phrase, stay home, stay healthy, stay safe, and in the end, we will be CHQ strong. Thank you.
I have one more.
Excuse me.
Sorry, it's kind of important because I want all the kids out there to know that I have heard from a very good source that the Easter Bunny is healthy and doing well, and he is taking all the proper precautions so that he will still be able to come around and make visits on Easter Sunday morning. But he wants you to know you're probably not going to see him this year like you may have in other years, because he is being careful. He doesn't want you to get sick, and he doesn't want to get sick. So please know that he is out there and he's thinking of you, and he's still going to be around in our community for you. Have a happy Easter.
Happy Easter, everyone.